afternoon and welcome to our webinar on COVID-19 vaccination rollout. Are vaccination passports the route out of lockdown? Vaccination passports seem to be one way to allow for some more normality. People who hold such passports, whether they are electronic, paper, with QR codes or any other device, they may be entitled to resume cross-border travel without quarantine restriction. They may attend sport and leisure facilities, or even work in certain public or patient-facing roles. So, what are the potential uses of vaccination passports? What are the medical challenges with regards to different vaccines and different virus strains? What are the ethical issues with regards to privacy, discrimination, and equity? And what are first experience and what is currently planned in European countries? My name is Matthias Wismar. I'm program manager with the European Observatory on Health Systems and Policies, and I'm your facilitator today, and I will guide you through the program and the session. Our keynote speaker today is Professor Siobhán O'Sullivan, Chief Bioethic Officer at the Department of Health in Ireland, and is responsible for drafting policy advice and legislative instruments on bioethic-related issues. She's also a professor at the Royal College of Surgeons in Ireland, and she has many other affiliations, which would take really quite a long time, but you find it in the background material. As spotlight speakers, today we have lined up Ruth Weizenberg. She's currently based at Technical University Berlin, but actually she is from Myers GDC Brookdale Institute in Jerusalem, Israel, and we've asked Ruth to report on Israel because Israel is already using a vaccination passport. We've also asked Franz Leich, he's director of ELGA, which is the company responsible actually for the implementation of the Austrian National e-health record system. And they're also in charge of introducing the general electronic vaccination passport. And of course, it is the organization which is meant to implement the vaccination passport, the COVID-19 passport, if it's going to come. So I think we will have here two very interesting spotlight speakers to fill us in on current development. So to what extent can vaccination passport help getting back to some more normality? What are the issues that need to be taken into account, and what can we learn from it for the future of health systems resilience? Just a couple of issues on the housekeeping. Our time budget is very tight, which is a challenge for all speakers. Please send us your questions and comments through the chat box. My colleague Erica will feed back the chat to us towards the end of the session. We're also going to record the video and planning to publish it later on our YouTube channel. And finally, we will send you an evaluation form, and we would kindly ask you to fill it in, even though you probably have already done so in a previous webinar, because it's really important for us to see about the quality of the webinar and to further develop this series. This is the 18th webinar in the series, and just stay tuned. Next week, Tuesday, we will have a webinar on the COVID-19 infodemic, which should be very interesting too. So before we start the keynote, I've asked my colleague Erica Richardson to launch a poll on the topic. Hand over to Erica now. Please, the floor is all yours.
Thank you very much, Matthias. So yes, just as a quick warm-up to touch base with you all, I was just wanting to launch this poll to see whether or not you want your country to introduce and use vaccination passports, but then also to dig into a little bit more detail around what vaccine passports should be used for. And you can pick more than one option here. So international travel, internal travel, accessing leisure facilities, accessing shops, attending mass events, or none of the above. Okay, so please do let us know what you feel about vaccination passports, and I'll let you know the results after after Siobhán has given her overview. Thank you very much.
Thank you so much, Erica. And without much ado, I would now like to ask Siobhán to give us the introduction and overview on the issue. Please, the floor is all yours, Siobhán.
Thank you for the invitation to speak about what I think is a very interesting topic that all of us are going to hear much more about in the coming weeks and months. I suppose the question has already been posed about whether vaccine passports are really a way out of the current situation a way back to some form of normality, or whether they in fact are going to pose a legal and ethical minefield for all of us. So in terms of the nomenclature, I think this is quite important. There's a lot of different terms that are currently being used in relation to vaccine certificates, passports, and then even immunity passports. And I think it's important to distinguish between all of those. So in terms of a vaccine certificate, generally here the purpose is a medical one. So it captures, the certificate will capture the vaccine that's given, the particular type of vaccine, the batch number of that vaccine, and the date of vaccination. So there's a couple of purposes for that, but they're all medical in nature. So it's really to ensure that the person is reminded, for example, to come back for a second dose, which we know is many of the vaccines are on a 2-dose schedule. Or in terms of a batch number, and we have currently something of that nature going on at the moment, if you think that there could be an adverse effect of the particular vaccine, and that can be traced back to a batch number, and you can then contact all of those individuals who've had a particular batch of the vaccine. So again, a vaccine certificate is something most countries will already be giving and have already given for other vaccines, but also for COVID-19, and the purpose being really a medical reason. Then we talk about vaccine passports, and this is different. And the distinction here is that the purpose goes beyond medical. So it effectively facilitates a lifting of public health restrictions on those who've actually been vaccinated. So that goes way beyond just a medical use, and we'll come to some of the potential uses for a vaccine passport. Then in terms of an immunity passport, this was something that was talked about much earlier in the pandemic. And it's still discussed to a certain extent, but it's important not to mix up a vaccine passport with an immunity passport. Immunity passport, or they're often they can also be referred to as recovery certificates, basically provide evidence of a past infection. And that then by inference means that you have recovered from the disease, you have circulating antibodies. So you may, for example, have an antigen test to prove that you have in fact mounted an immune response to the SARS-CoV-2 virus that you have contracted. And by extension, then there's an idea that you will have immunity to SARS-CoV-2. So your chances of reinfection are very low, and therefore you're considered to be somebody who the risk associated with you is rather low, and therefore you can be given access to certain privileges that other people might not be. So the difference between a vaccine passport is somebody who's been vaccinated, an immunity passport is somebody who's already had COVID-19. Now, I'm not going to speak about immunity passports today, although many of the issues are similar between vaccine passports and immunity passports. But just to say, one thing that is distinct about an immunity passport is that there have been discussions around the moral hazard associated with handing out immunity passports or recovery certificates, because you may be providing some sort of perverse incentive for people to actually become infected with SARS-CoV-2. So they're seeking out the infection, especially younger people who feel that perhaps the consequences of getting COVID-19 are not particularly serious for them. And so you create this perverse incentive. But my presentation today is mainly focused on vaccine passports. So what could a vaccine passport potentially be used for? Well, many people have referred to them as the golden passport, or indeed the chance card, the get out of jail free card. So one thing that's being discussed very much is the idea of using vaccine passports, and that's where the name comes from, for getting access to international travel. So those who would have this vaccine passport, who could prove that they've been vaccinated, wouldn't be subject to travel bans that exist in relation to entry into certain countries at the moment, or indeed wouldn't be subject to, for example, quarantine requirements that several countries have. Many countries now require inbound travellers to quarantine for 14 days, and indeed to have testing during that period. So you might be subject to none of that if you have this vaccine passport. But there are other uses beyond travel. Work-related presence. So for example, one of the advantages of the vaccine passport has said that we can safely reopen our economies. So we can allow people back into the workplace. So we know that they will have less risk once they're vaccinated, and I'll come to that. And therefore we could start to have not alone essential workers, but of course essential workers would be the first line workers, to go back into the workplace, but other people too. Then it goes well beyond the workplace and allowing people to actually participate in large organized events again, be those cultural activities like concerts, cinema going, or even gyms. And then there's also issues around access to health services. So at the moment, many countries are suffering from outbreaks in their hospital systems, COVID-19 outbreaks. And so what we've seen is that most of us in Europe have prioritized COVID-19 care in our hospital systems, but that has meant that many people with non-COVID related diseases have actually had to step back and have had their care to some extent postponed. So this would be a way of allowing people to safely enter hospitals and ensuring that even if there were COVID patients there, that people could have elective surgeries. Also in relation to, we've also, as in Europe, suffered from those who are in older persons residential care facilities, or those who are in long-term residential care facilities haven't had access to visitors, obviously on a risk-based basis, because they're introducing COVID into many of these residencies. So what would happen here is that if, for example, my mother was in a long-term residential care facility and she and I were both vaccinated, that I would be able to go and regularly visit her again. And many other people have said, quite apart from all of this, it might actually act as an incentive for people to become vaccinated. So either an antidote to vaccine hesitancy or indeed to anti-vaccination sentiment. So those are the kind of uses to which a vaccine passport might be put. So what has the international response been so far? Well, the WHO doesn't currently recommend vaccine passports, and that's largely due to the scientific uncertainty and possible negative effects on high-risk groups. So I'll come to the scientific uncertainty. WHO is worried that we might be, if we introduce a vaccine passport, there would be an incentive to actually start vaccinating different people in a different order. So I'll come back to that as well. They have established an expert group on this issue, which will look at legal and ethical questions, as well as the actual practicalities of introducing a vaccine passport. And that group is expected to report by July this year. The ECDC, in their 14th update in February, were supportive of vaccine certificates, that's for medical purposes, but said that at the moment it was too early to have a view on vaccine passports. And they were of the view that it shouldn't exempt, a vaccine certificate shouldn't be used to exempt international travelers from testing or quarantine requirements. So again, supportive of the vaccine certificate, much more ambiguous around the vaccine passport. The Council of Europe Parliamentary Assembly have recently come out with a resolution 2361, and they have made clear that they consider that vaccine certificates should only be used for monitoring things like the vaccine efficacy, potential side effects and adverse events, and they shouldn't be used to lift public health restrictions. The European Commission, however, has taken a slightly different view, and they have announced on March 1st that they are working on a digital green pass to include vaccinated people, so a vaccine pass, but also, as I said, a recovery pass, which will give access to results that somebody has already had COVID and has recovered from it. And the purpose of this, as announced by the European Commission, is to facilitate travel for both work and leisure purposes. And they hope to have that introduced by July this year. So we know, and we're going to hear about that, so I won't say too much about it, but other countries, like for example, Israel has already introduced a green pass. Greece and Cyprus have eased travel restrictions for Israelis with proof of vaccination. Iceland has said that it will recognise vaccine passports and will no longer require people to have testing or quarantine requirements. And the CDC have also come out in the last number of weeks and said that fully vaccinated people within the last 3 months will not have to quarantine if they are identified as close contacts. So this is the kind of international scene currently, so a rather mixed response. So what are the challenges facing us in introducing vaccine passports, and some of the main issues that have been raised, and some of the, I suppose, uncertainty that the WHO and indeed the ECDC have pointed to is that all of the vaccines have different types of efficacies. So you see the wild type efficacy there. So in terms of the 4 vaccines that are currently authorized within the European Union. So obviously the 2 mRNA vaccines, Moderna and Pfizer, have very high efficacies, slightly lower with AstraZeneca and the J&J vaccines, but nonetheless, you're still talking about none of them has 100% efficacy. So there will never be 100% protection. And people say, well, if you can't guarantee 100% protection, so how high is high enough? And I suppose when you think a 94 to 95% efficacy, in real terms, that means for every million people that you vaccinate, 50,000 of those won't actually be protected. And when you go to an 85% efficacy, that means for every million vaccinated, it's going to be about 150,000 people who are not protected. So it's not insignificant. Then there's the other issue, which is the emergence of variants of concern. And I've listed 3 of the main variants of concern that are worrisome in the European context and have started to circulate. Indeed, in the case of B117, that's become the predominant circulating strain in many countries. We see that the vaccines we have currently authorized for some of those have the same level of efficacy, but in some they have reduced levels of efficacy. So as these variants start to emerge, our vaccines will not be necessarily as effective against each of these variants, and that needs to be kept under consideration when we talk about vaccine passports. Also, the question around duration of immunity. At the moment, we really don't know the risk of reinfection with SARS-CoV-2. We know that it's quite low. And but we also know there's a waning of the antibody response 3 to 6 months post-infection. So at the moment, we really just don't know how long your immunity will last after a vaccine. And the other big issue, transmission. We really don't know the risk that fully vaccinated people could continue to spread SARS-CoV-2 to other people. That's still uncertain. We have a lot of good emerging evidence in the last number of weeks that suggests that there will be an effect. So it will protect you against transmission, but the magnitude of that effect, we still don't know. So a couple of the ethical issues then. Sorry, I need to speed up, I see. In terms of discrimination, there is a worry that we will discriminate people, we'll start to stratify people based on immunological fitness. So there will be those who will get access to certain things and those who won't, based on their immunological responses. And it's important to mention here that discrimination per se, it's not a given that this will be discriminatory, because it's not necessarily unfair to treat those with relevant differences differently. So that's important to say. However, there are issues around people who can't be vaccinated. For example, the vaccines are not authorized for use in children. There are those for whom it would be contraindicated because of severe allergic reactions, or even those who might mount a suboptimal response. So, for example, immunocompromised individuals. And then there are those who simply won't wish to take the vaccine. So for that latter group, we're effectively saying that vaccine passports could de facto start to make vaccination mandatory. So many countries have decided not to make COVID-19 vaccination mandatory, but if we introduce these vaccine passports, have we effectively made it mandatory by the back door? Simply because in order for someone to actually exercise a meaningful choice, that actually depends upon them having a range of options with tolerable consequences. But if you cannot travel, if you can't go to the gym, if you can't go to a concert, if you can't meet friends, if you can't go back into your workplace, does that mean we're starting to coerce and perhaps stigmatize people who don't want to receive the vaccine? So then we need a broader discussion about mandatory vaccination. The other issue that's really worrying is that many people say if we introduce these vaccine certificates, there will be an impact on solidarity and social cohesion. Solidarity has been one of the key principles that has underpinned the pandemic response. And there is a risk that those who remain unvaccinated will feel very resentful. And at this moment, the rest of the way through the pandemic, we've basically mutualized all of the burdens that we've all had to bear. So everybody's had to wash their hands, everybody's had to stay home from work except for emergency workers, etc. And then we'll create this them and us scenario, which may actually fracture the willingness to actually comply with public health responses. There are also equity issues. So we know that we know very clearly, and that's seen consistently across Europe and across the wider globe that marginalized groups are disproportionately affected by COVID-19. We also know that these groups tend to have higher vaccine hesitancy. They have lower levels of media or health literacy, which makes them more susceptible to misinformation, for example, about vaccines. They may indeed have less access to health services, we know that. So therefore, we basically could be further disenfranchising these individuals or reinforcing structural inequalities. There are also issues for people, for example, living in rural areas or in areas with less well-resourced health services. So they will be last to get the vaccine potentially, and that then creates real equity issues. The important thing, I suppose, then there is back to the WHO point, they're very worried that because of our nature of vaccine prioritization, so that's fairly standard across the globe where we have vaccinated or prioritized those who are older for vaccination, those who live in residential, long-term residential care and healthcare workers, that what it could happen is if this is about facilitating travel, etc., that you will start to vaccinate, perhaps prioritization might change, you might choose to vaccinate different people, and therefore that could incentivize queue jumping, which is really problematic in terms of the fairness of the entire vaccine rollout. Really important thing is that it's not just within borders, but between borders. I suppose this graphic is just to show you that there will be large swathes of the world who will not be vaccinated until 2023. And that's despite good initiatives like COVAX for vaccine sharing, equitable distribution of vaccines. But we're still seeing a lot of vaccine nationalism where people want to actually vaccinate their own populations first. So it means that there will be large parts of the world who simply won't be able to access any of these rights until they get to much later. Then finally, there are privacy concerns. So there are issues around that people are saying this is simply increased surveillance. It's about digital identities for everybody. We need to be aware that these vaccine passports, which are likely to be electronic in nature, will actually contain sensitive personal information. And then there's the point that there are many people who simply don't have access to prove their identity, and that's 1 billion people over the world. So I think there are several ethical issues that we need to be mindful of, several things that we have to work our way through, and I think we have to balance the rights of those who obviously may be vaccinated and feel, well, I'm no longer a threat, I don't spread infectious disease, therefore I want to have my civil and liberties back, and those who say, well, hang on a second, I'm being deprived of those very same self-liberties because I haven't yet been vaccinated. Thanks very much.
Siobhán, thank you so much. I think that's a fantastic overview on the possibilities, the complexities, but also the ethical pitfalls of introducing vaccination passports. And no matter what countries are going to do, I think they need to take into account all of what you've been saying. Erika and Annalisa, can we have the results of the poll, please?
Absolutely. Some very, very interesting results. So first of all, although there is broad support for the introduction of vaccination passports, 1 in 4 of our audience today said, well, no, actually, they don't want them introduced. And the support is overwhelmingly, if we sort of like going into a bit more detail, the support is overwhelmingly for vaccination passports for international travel. But also, I think there are lots of people wanting to go to music festivals this summer because attending mass events is also something which is seen as a very useful way of using vaccination passports. So interesting results. Thank you very much.
Thank you so much, Erika. And I wonder whether the results would have been slightly different, you know, after, if we have taken the questions after Siobhán's presentation, because I think that those people who already had a couple of concerns probably would see themselves kind of reinforced in this. But, you know, we are now testing a little bit the ethical questions and the medical pitfalls and all this with the empirical evidence. And there is in Europe, or in the WHO European region, a country which is a little bit ahead of the curve and which has already introduced a vaccination passport, and from which we hopefully can learn a lot. And I would like now to ask our spotlight speaker, Ruth Weizenberg, tell us a little bit about the Israeli experience. The floor is all yours, Ruth.
Thank you for inviting me to talk about the Israeli experience. And actually, yes, the vaccine passport and the green pass are already a reality. In Israel, we have two types of documents. As Siobhán has explained, there is a slight difference. There is the vaccine certificate and the green pass. But I think that one of the most important things to talk about Israel is the point in time where they have introduced these passports. As you know, Israel has already vaccinated a very large proportion of its population. If you have a look at the percentage of people with the first and second doses of the cohorts above the age of 20, it looks like more than 70% of the population has been vaccinated already. And Israel started the campaign in December 20, so it's been almost 3 months, and only Pfizer vaccine has been administered, so it's kind of easy to make this kind of passports. So why is this important? Because Israel started to implement the vaccine passports only on February 20. It means that at that point, all the population was already eligible for the vaccine. So people who wanted could get the vaccine. Those who didn't get the vaccine were those that didn't want to. And this is important because regarding ethical issues, if you don't have the option to get the vaccine and you want the passport, but you cannot get the passport because you can't get the vaccine, this is problematic. But if you have the option, maybe this is less problematic. So the first document that they are issuing is the vaccination certificate. This is how it looks like. It has information about the vaccination type and date and the expiration day. It's issued by the Ministry of Health. It's an official document. It's given 7 days after the second dose. It's valid for 6 months, and it's given to any resident aged 16 or more, because these are the people that are eligible for the vaccination. It means that it excludes children. And what it gives for now, it's only exemption for quarantine, and this is not yet recognized internationally, except maybe Cyprus and Greece, as Siobhán has commented. The second document is a certificate of recovery, also issued by the Ministry of Health. It is given 20 days after a positive test, and if the 3 precedent days are without any symptoms, it's valid for all people until the same date, the 13th of June, and it can be given to any resident, so this includes children. And finally, there is the Green Pass, and this is an official document issued by the Ministry of Health, but this is for internal use only. This is not something recognized by other countries, and it doesn't have any information about the vaccination or the recovery. This is only an access to businesses that comply to the Green Pass requirements. The validity and the eligibility are the same for the first 2 certificates. It means that most children don't have access to the Green Pass. And currently it does not apply for the rapid test. It's been discussed and probably it will, but it's still in discussion. So how do you get the certificate? You can issue that through the Ministry of Health website. And most people download this certificate from the traffic light app, and it's digital. You don't have to print. If you go to a place that requires the Green Pass, you show your app with this with the barcode, and the owner of the shop, for example, he can screen it, and then he can see if the certificate is legitimate or not. And people who do not have access to internet or apps can call the Ministry of Health call center and request the certificate by email, fax, or even mail. And so what does it give? It gives exclusive access to a lot of places. And contrary to what people think, it's not only for leisure or going to shops. In Israel, only students that have the green pass can enter the university campus. Only those can participate in face-to-face classes. High schools where 90% of the students have the green pass can have face-to-face classes, and obviously sport and cultural venues. The thing is that masks are still enforced everywhere, including in these places, and physical distance should be mandatory. And as I told, the concern is that it's difficult to enforce and children are mostly excluded. So this is it from
Ruth,
Israel.
thank you so much for this spotlight on Israel. I think that was super useful. I'm going to take a couple of key lessons from it. Number one, there's not only one pass, but actually, as Siobhán said, we have several passes in circulation at the same time. Number two, I think it's quite critical to understand the right timing, the moment when you introduce the pass. And from your discussion, it was clear, was already quite advanced. And Israel is probably a much simpler case because you just have one vaccine, so which makes the comparison between the efficacy between the different ones much easier, and clearly the validity is rather limited. But thank you so much, Ruth, for this first very telling insight. And I think we come now to our second spotlight speaker, a country which is preparing for maybe following Israel, maybe not following Israel. We're talking about Austria, and I said Franz is the director of the company which is in charge of the Austrian electronic health record, and also you are rolling out, I think, the general vaccination passport, and now you will be tasked with this one. So Franz, the floor is all yours. Please fill us in on Austria.
Welcome. My name is Franz Leisch. I'm the director of ELGA. That's the company responsible for the Austrian health record system, national one. And I'll now tell you a little bit about Austria. Compared to Israel, our vaccination rates are more, a little bit lower. But you see in the 85 rate, we already have 50%, and then it gets lower. Those are all numbers from our national vaccination registry. And because of the discussion before, I just looked in the numbers from today, and you see we have mixed vaccines. We have about, the majority is BioNTech, Pfizer, but we also have a share of about 300,000 of our around 1 million vaccinations from AstraZeneca, and 60,000 around from Moderna. So this makes the validity of the vaccination a little bit more difficult, maybe. And now I just wanted to show you the Austrian numbers, which I took from the Ministry of Health, the data yesterday. And you see we have about 9 million population and about 450,000 recovered people, and around 9,000 deaths, and the incidence about 210, I think it was today. And we are doing a lot of tests and vaccinations, and I give you now the current numbers. It's about the tests, the rapid tests, those are registered. Those are not those that people doing at home. We register about 200,000 of those tests daily in regional databases. We call it Austria tests. They are web platforms, and people getting SMS about the results, and you need those, for example, to enter barber shops or something like that. That's in place, but mostly at the moment on paper. And second, we have the PCR tests. We do about 50,000 PCR tests daily. I think we have a positive about 2,000 a day. And those we have databases, national ones. For the positive ones, we have an epidemiological detection system of the Ministry of Health. And we have a screening database where we collect all the negative results already. And the fourth system is the vaccination registry, which we in ELGA are developing and running. And we have about, at the moment, 40,000 vaccinations daily getting into our system. Yesterday is about 1 million, about 40,000 get every day come forward. And then you see all those databases, they allow us technically to make all the certificates, the test certificates, the certificates of recovery, and the vaccination certificates. And in our vaccination registry, we're also working on like collecting from the laboratories the antibody tests, the titers. Okay. So now Matthias, he asked me like to give you a slide how the current system looks like. This is like work in progress. But what we can tell you is that the colleagues from the ministry, they already are from the rapid testing and from the PCR test. We are already making national certificates. Like they can be used additionally to the paper which you get handed. You get an SMS link, and then we are also like working on an app for like stores to check that. And we are also having already planned an app for the people themselves. And down there, you see that like we are also planning to do the certificates of recovery and also the vaccination certificates, maybe with the same system, but that depends what the European Union recommends as technical framework. Because what we, for example, have in Austria, we have an online verification system with a server in an Austrian server. Now I want to go back what the European Union maybe will do. They said they want to facilitate the free movement with the passport system for the vaccinated, tested, negative, and recovered ones. And as far as the scientific evidence is clear, and if you hear before the presentation that evidence, I think needs maybe a think over, and they proposed a legislative proposal for tomorrow, and mainly I think for medical purposes for the certificate, and that's will in my next slide maybe be a question. And they also propose to make a technical framework on the EU national level to facilitate the authentication. So, and now the last slide is what are the challenges now for somebody who's like working in a country on the certificates topic. I definitely, if you look in all the literature, we see a definitely difference between the medical and the political positions. Because the medical position is like wait for more data. The political ones say, okay, no, we have to go forward and to facilitate living again. And what I definitely miss, if I check that, I need the standard rules. Like, will there be like one traffic light, or will be 3 traffic lights? Will the equivalence of the methods and of the vaccines, is the Pfizer the same as the Moderna? Then we see there's multiple technical frameworks. And I know we are developing standards ourselves in Austria. How long it takes to develop a standard? We see a lot of local solutions. All the regions, starting their own solutions. We see like workflow systems already implementing themselves. We see a lot of private political technology providers. We have the discussion about the online and offline verification. We have the legal problems. And then we have, of course, those all non-medical and medical uses. And you see, that's a lot of things to consider. And I'm looking forward to make all the things we do in the European family, and not only in Austria, because it would be a lot of stranded costs.
Franz, thank you so much for this insight on Austria, and you are one of those who is the closest to the developments, actually, both in the political arena, but also in the technology and medical world. And I heard that you are actually kind of reiterating or re-emphasizing some of the concerns Siobhán was mentioning in the very beginning. And if vaccine passports are part of the route towards more normality, then it's probably a winding road and maybe even a little bit of a bumpy road. Thank you so much for all these presentations. I think we have now quite some time for questions from the audience from the chat box. Erica, have we got some questions, please?
A lot of questions. I'm just going to run through a couple, and then you can pick what you fancy answering. So, first of all, we've talked a lot about national solutions for vaccine passports, but particularly given the WHO position, is there a role for these international organisations such as WHO or the EU in sort of working transnationally in implementing vaccination passports, and at what level? should we be concerned about false passports, things like this? How can we ensure the security not just of personal data, but also the security of these passports in terms of falsification? And what do you do when they expire? Maybe this is a question more for Ruth, but what do you do when they expire? If they're only valid for 6 months, do people then have to get a booster shot? Is that data informed? Sort of, because this is an ongoing epidemic, what are the solutions for that? And what do we do about recovered people? If the certificates are only valid for 6 months and the person got their infection more than 6 months ago, what do we do about sort of like the recovered people? But then there's also the standard questions about what do we do about people who can't be vaccinated? Not that they won't be vaccinated, but they cannot be vaccinated. How can they access services? How can they have equitable access to education and things like this? And there was one question which I'm paraphrasing, but this is probably one for Siobhán as our ethicist in the room. But surely it's okay to punish those who won't vaccinate because they're endangering the rest of us. So there you go. That's just a few
really
questions.
Great questions coming through the chat box. And maybe we just go in speaking order, Siobhán. Just pick out what you want to respond to and try to be brief that we have a second round. Okay, please, Siobhán, the floor is all yours.
Thank you, Matthias. So I will take the role of the WHO and the latter question, rather provocative, but I think there is a role for the WHO, and many of you will be aware that we already have a certificate, an immunization certificate for yellow fever. That is actually coordinated through the WHO. So there's a global aspect to it. So I think that is actually important. Mind you, it's a single vaccine, so it's easier. But so yes, there is a role for the WHO. In relation to whether, well, look, if you won't take it, too bad, we can be punitive. We can say that you don't access all the services everybody else gets to access because you put the rest of us in danger. I think the problem with that, and there is an argument around being a free rider, so you don't get the vaccine, but you expect everybody else to get it. And that there are many people who feel that that is unethical. But there's also the question that if you have a sincerely held view, that for whatever reasons of conscience or otherwise, that you don't want to take a vaccine, we have not made this vaccine mandatory. And as such, unless you make it mandatory for everybody, we are saying to people, you have a choice. So what you can't do is punish people for exercising a choice and for making the choice that you disagree with. So I think that's the problem.
Thank you so much, Siobhán.
Yes. So regarding the expiration of the vaccine, the green pass or the vaccine certificate, there are some plans to extend it beyond 6 months. I think this is something that the ministry is thinking because they're gathering more data to see for how long the vaccine it works on the immune system. So there's no enough medical evidence, and therefore the validity is so short. I think that as long as more evidence, medical evidence will come, the policy might change. Regarding those that have recovered, all of them have the same expiry date, which is the 30th of June. This is because it's very difficult to know the exact date of the infection, and this might change as well. And those who cannot get vaccinated because of medical conditions, for now, they don't have a solution, not that I have heard of, the same way with children. That it's a big population that doesn't have access to a lot of places right now. But I think that the ministry is trying to see how the GPs or physicians can give a certificate for these people who have counterindication for the vaccine. And then with this certificate, they can get the green pass in order not to be excluded from social life and other things. And I think that one question we have to ask ourselves regarding these certificates, all these certificates, is it an incentive for getting people vaccinated, mainly those that have some degree of hesitancy? They're not against it, they're just not in a hurry to get the vaccine? Or is this a punishment for those who don't get the vaccine? And I think that the timing where you provide these certificates is key here, because if you provide the certificates in a time where not everybody have real access to the vaccine, this is problematic. But I think that once that everybody have the access, this ethical problem the balance may change. I'm not saying it's not problematic. I think that the balance may change. And also in Israel, the experience is that the effect of the Green Pass is somewhat limited, because when you have such a broad coverage with the vaccination, the economy starts opening by itself, because the number of infected people are dropping and the numbers of hospitalized people is dropping anyway. So the access to these public places would be open anyway. I think that the Green Pass just speeds that up until a point where the places would open anyway. So it's for a brief period of time that it makes a big change, because soon Israel will be a green country. People would be able to travel anyway without the passport. So it's for a limited period of time that it's such a big deal. That's what I believe.
Thank you, Ruth. I was just wondering what happens on the 30th of June. You know, when you do your vacation on a Greek island, do you need to move directly into quarantine when it expires while you're away? But anyway, Franz, please.
I just want to. I used to be a political advisor to the minister, so actually, I think the politicians they have to act. I think the people they want, you know, every straw, they take every straw, and I think that the politicians, they're really like thinking this is the big thing. And actually I mean it's like the medical view and the political view, and I think that's like now the risk of the politicians and even of the societies if they decide they want to do something like that. And actually I see the technical point. I'm developing the technical solution, but you also can do this with paper anyway, like the ethical question. And the question is like, does it make sense and even worth it, like to implement a system which is only like useful for the next 6 months, you know? And yeah, those are the questions, you know. You know, we only have to present them to the politicians, and they at the end have to decide, you know. But I don't know. You know, it's not an easy task.
Thank you so much, Franz, to remind us that this is really these issues are developing within a political force field. And of course, policymakers, they are encountered by lots of demands and expectations. They also make a lot of promises, you know, and as you say, something like a vaccination passport seems to be a great thing. But of course, you know, then people like you need to remind them and need to find feasible solutions, actually, you know, that can put this forward. Erica, anything else in the chat box?
Yes, a couple of things, and we've got just enough time, I think. So one small question and one big question. So the small question is around testing. So is there where we're talking about different testing systems, so lateral flow testing, PCR testing, are they equivalent? Should they be treated as equivalent when we're talking about people testing positive and then getting a certificate at the end, which gives them a green pass? But also, what do we do in countries which were particularly badly affected in the first wave, where there was a shortage of tests? How do these people say, yeah, I have immunity, I have had COVID, but they can't necessarily get the certificate because they don't have the test result to show that? So those are sorts of some of the smaller issues that have come up. And here's the biggie, here's the big one. So should we not wait to give like these sort of global WHO type vaccination certificates? Should we not hold off on that? Because there's a global equity issue with vaccination passports enabling travel for people in the global north, but excluding people in the global south. There's also, it has to be said, countries within the European family. Some have access, some don't. So what about solidarity?
Excellent question. Thank you so much, Erica. And I think the letter really links to the slide Siobhán was showing, the green shaded world map, actually. And some countries will not manage to get the population vaccinated until 2023. So this will be a long-lasting inequity. And how do we deal with this? Please, Siobhán.
Yeah, so I think I'll take the testing question first. I actually think that immunity certificates are really problematic, for exactly the reasons you've just said, Erica, that have come up in the chat. Different types of tests have different specificities and sensitivities. So we have false positives, false negatives. Many people, when their systems became overwhelmed, including here in Ireland, didn't test everybody who might have been symptomatic, simply because we couldn't do it. And that's true for everybody. Now, you could say, well, fine, we can do antigen testing for those people to see if they actually mounted an immune response, but that may have been way back when, and their immune response may have waned in the interim. So I think there's a whole load of problems, not to mention actually incentivizing people to have COVID parties, etc. And that doesn't even take into account the implications of long COVID, which I think is something that's going to become more and more talked about and is going to become more problematic. In terms of, and I think Ruth has already made my point, in terms of whether we should wait or not, there's a real question around the utility. I mean, we didn't introduce a vaccination kind of certificate for yellow fever until it was widely available to everybody, until there was an approved vaccine by the WHO, which we knew the efficacy of, we knew what the immunity was, etc., how often you had to have a booster shot. The problem with that is, as Franz has said, is that the whole idea, the promise of this has been that it will open up our economies, that it will allow us to go back to some normality. So saying if we wait that long, one has to really wonder about the utility of it, right? It's a long-term project. If we do it too soon, one has to wonder about the utility. So there's a question about this period in the middle, and it's to ensure that anything we introduce, and I think this is really important, that the decisions we make now under these very pressured circumstances, both for policymakers, politicians, and the population, we really need to pause, think them through, and see what kind of long-term implications it might have for things like solidarity and equity and discrimination.
I will give my opinion. I'm not sure if it's an expert opinion, but I think that the recovery certificate and for sure the rapid test might crowd out the incentives for the vaccination. I think that if the Green Pass serves for anything, it's as an incentive for people to get the vaccine, mainly the low-risk people, young people. And maybe if you allow people to enter these public places with the fast rapid test, then they won't have such an incentive. So this is also something people have to have in mind. And if we should wait for this green passport, I believe yes, because it's not fair to give a right for a person and not to give the right for another person, but when this person cannot really get the vaccine. So it is problematic.
Thank you so much. So fully aware of the ethical complications here. Franz, please.
I will talk about the thing we discussed earlier about those onions. You know, I think that every local government, even the districts or the towns, they are they have to make some regional use, and then we make the next level, maybe the national level, maybe like Israel, and then we have the European, and then we have the worldwide solution. And it will be very interesting how we will make all those levels. I'm sure everybody will start a local solution, then all the countries will come to a national solution, and maybe in 3 or 4 years we have an international one. But nobody will wait until the full international everything is working. It will develop, and if we on the national level we are hesitating, the towns, they're doing their own systems. So we have to be aware of that. Everybody will act.
Franz, I think this is one of the conclusions actually coming from the whole pandemic responses, that we really need to think through the global governance setup, and whether we are fit for such a challenge actually. I think we are almost done. We are still 4 minutes ahead of the schedule. And as usual, we invite the keynote speaker, Siobhán, to have last couple of sentences, if you wish to, before we are going to close this session. Siobhán, please.
Yeah, so thank you so much, Matthias, and thanks to everybody for, I think, a really interesting exchange. I think that a lot of the issues that have been raised today, I don't think vaccine passports are something that we can simply dismiss out of hand. And I think, as Franz has said, there will be developments in any case, and the European Commission has taken a leading role in this, certainly within the European context. But I think as policymakers, we need to be really clear that we need to take on board, not alone, I think, practical issues. And I think Ruth and Franz have put those out. Practical issues, it's no good to me if I can travel, but I can't travel with my children, for example, on holidays. I think we need to think about privacy issues, about who has access to my data and for what reasons. Is it reasonable that my gym or that my local shop knows things about my health status? And then what does this mean in terms of both at the local level within our own countries, about how we as groups of people actually treat each other, and what rights we extend to each other on the basis of whether we have access to a vaccine, which for most of us in Europe, and certainly for the rest of the world, is not something we have any control over currently. And I think that those are the kind of questions we need to be asking ourselves. And instead of always being led by, here's the technology, you can have this pass quickly, how do we organize it? To ask ourselves, what values do we want to protect in Europe? What do we want to, are we really serious about discrimination, about those rights that people have not to be discriminated against, etc. And are there ways, there may very well be ways of coming around all of these problems. And that's why I think panels like this are so wonderful, where you have real life experience and those are people who've been tasked with developing it. But I think we really all need to actually say, what are the values we want to protect here? And can we do that while delivering this? Thank you very much.
Siobhán, thank you so much for this great wrap up. And thank you so much, Franz, Ruth, Erika, Annalisa. And thank you so much for joining us today for this great webinar. I think I learned a lot actually, and I can't wait for next week's webinar on infodemic. So tune in and bye-bye until next week.